Thank you, Mr. Speaker. I rise today in strong support of H.R. 6703, the Lower Healthcare Premiums for All Americans Act. When the Democrats passed Obamacare over a decade ago, they sold the bill on the promise that it would lower healthcare costs and preserve plan options. If you like your plan, you can keep it. If you like your doctor, you can keep them, we remember quoted. These famous last words still haunt us. Today, we know that Obamacare has not lived up to the Democrats' lofty promises. Instead, the consequences of that bill continue to burden American patients as they have since its enactment. Healthcare spending has nearly doubled since Obamacare passed. Healthcare plan options have been decimated by Democrat overreach, and millions of Americans are saddled with medical debt across the country. Obamacare premiums are up 80% since the program's inception, with patients paying on average $5,000 out of their own pocket to hit their deductible. The average out-of-pocket spending maximum for 1 year is over $20,000. Without a doubt, Obamacare has proven to be unaffordable and unsustainable. In an attempt to respond to the affordability crisis created by Obamacare, Democrats leveraged a public health emergency to shovel hundreds of billions of dollars to big health insurance plans to mask the risk of rising unaffordability of coverage. First in the American Rescue Plan of 2021, and then again in the Inflation Reduction Act of 2023, Democrats sent temporary taxpayer-funded enhanced premium tax credits directly to the coffers of big insurance plans. They did this without a single Republican vote of support. And on both occasions, Democrats chose to make these COVID credits temporary. They could have made them permanent, but they chose instead to focus on advancing priorities for wealthy Americans, which some of these they did make permanent, to buy subsidized electric vehicles for politically connected cronies to siphon off federal dollars of the greenhouse gas slush fund. Now, Democrats are uniting behind a policy to send billions more of taxpayer dollars to big health insurance plans. With the Democrats' temporary COVID credit set to expire at the end of the year, they are attempting to turn their policy failures into political gains using the American people as collateral. It is worth reiterating, Democrats funded temporary Band-Aids to cover up unaffordable care. They set the expiration dates. They chose to fund liberal priorities instead of making them permanent. While Democrats continue to fearmonger, I want to shed light on what Republicans are doing to fix the Democrats' affordability crisis with policies that deliver real, lasting relief to the American people. These include eliminating health plan gimmicks like silver loading, which will lower AC premiums by 11%, increasing transparency for pharmacy benefit managers, the middlemen, and the lower costs for drugs for all Americans, and increasing affordable plan choices and putting patients back in the driver's seat for their own health care plan choices by instituting a healthy association health plans, choice arrangements, and stop-loss insurance. This proposal results in more than double the premium reduction that Democrats' extension of the enhanced tax credit subsidies. The Congressional Budget Office estimates this plan will lower premiums by 11% to compare just 5% from the Democrat subsidies. These policies will also lower health care costs for all Americans, not just the roughly 7% enrolled in the Obamacare marketplace. And many of these policies are bipartisan. Ending silver loading addressing nefarious PBM practices and strengthening employer insurance marketplace all have garnered broad bipartisan support. I hope we can overlook politics that are clouding the issue and come together to pass this bill and continue to work together in 2026 to deliver more affordable health care to all Americans. I reserve my time.
Gentleman reserves.